Hi, I'm Ab Brody, a geriatric nurse practitioner at the Bronx VA and assistant professor at the NYU College of Nursing. I'd like to introduce you to Mr. Murphy, who has been a patient in your community-based outpatient clinic for the past 10 years. Over this time, you've seen many momentous life events and tragedies, such as the birth of his first grandson and the death of his wife. Recently, however, you've noticed his behaviors have started to change, but you're not quite sure how. That's where this section of the geriatric scholars community is here to help. Over 5.2 million Americans currently suffer from Alzheimer's disease, many living without a confirmed diagnosis, and hundreds of thousands additional individuals suffering from other dementias. As the U.S. population ages, this number is expected to rise dramatically, especially given that age is the #1 risk factor for these diseases. 1 in 9 Americans older than 65 has Alzheimer's disease, and about 1 in 3 older than 75. Within the VA, approximately 10% of veterans suffer from dementia. As primary care providers, it's our responsibility to recognize when veterans and other older adults develop mild cognitive impairment or dementias, and work with them and their caregivers to ensure they receive the appropriate care that will allow them to live with the best quality of life possible, helping to maintain their dignity in the process. The information in this section will help you to understand how to identify and differentiate depression, dementia, mild cognitive impairment, and delirium in older adults, and help to treat these patients' physical, behavioral, psychological, care planning, and spiritual needs. So in the case of Mr. Murphy, we will find an appropriate screening instrument, such as the SLUMS, to detect cognitive impairment, learn about the necessary tests to confirm the diagnosis of Alzheimer's disease, and learn how to treat the symptoms of his disease and ensure appropriate advanced care planning so that we are truly meeting Mr. Murphy's needs.